what are the goals for my practice going forward for golden red medicine? Well, now that I'm back here and we've like come back to America to, so that I can also incorporate spiritual and mental health into and really truly be an integrative practice. That's what I really want. And so to treat, someone's body and their mental health and their spiritual health, you need the time for that. But I'm starting to incorporate ketamine therapy into my practice along with the functional medicine. So everyone gets their lab work done. You also, we have a consultation to see if, ketamine therapy is right for what you're dealing with, anxiety, depression, overwhelm, being stuck. It can help, a lot of people, and the research is coming back so amazing. And I also think it would help people get off their SSRI medications, which are so problematic and cause so many other side effects, that I would love to really help people try to wean off of those through using other, medicines to help them find their joy in other ways, and to know that it's inside themselves, and to kind of meet that. I want people to really be able to, meet their inner healing. We have this innate healing that we've been given inside of our bodies that we often are just so detached from. And so, so psychedelic medicine can help you find that inner healing that is there, and also help, the inner critic that, is always going on in your mind. And so there's a lot of things too for mental health to do to help people. And one goal is in the practice is to have more community based, like either circles or day-long intensive retreats, like 3 or 4 days. And eventually I would really like to have a retreat center where all of this can run through. So we can do the food, we can have organic food growing, we can have the community circles, we can have exercise, we can have yoga, we can have meditation, and all the things that we all need. And so people can come for a week and like learn all the skills to put together for themselves and try medicines that might work for them. And so that's the ultimate goal, is a retreat center. But until then, having some intensives and getting the community kind of together on things is a goal for me. And another goal for the practice this time, I'm starting some group functional medicine groups, because I also feel like functional medicine, unfortunately, is very expensive and it's out of reach for a lot of people. But it's so intensive one-on-one doctor time, that's why it's so expensive. And then the labs get expensive, but there are ways around some of that. And so I'm going to start some group programs where I see people individually for shorter amounts of time, and then we meet together and go over similar labs and similar things. So finding people that have the same concerns, the things I keep seeing over and over again. I did keep my practice in New Zealand, and I kept a very few patients, and did take some new patients that were, referred. And I really kept seeing estrogen dominance in women who are premenopausal, and people think that they, mentally, and, PMS and period problems and painful periods, those are not normal, and they lead to anxiety and depression over time. And so I feel like a lot of people have these mental health issues, but they're stemming from hormone imbalance. So I'm going to get a hormone balance group going. And I'm also going to do, and I also keep seeing a lot of things for long COVID. People get COVID and they have migraines, they have fatigue, they have all these things they can't get rid of after having COVID. And some people are having issues with that from their booster shot, or there's just so many spike proteins that we're getting now, because everyone's had, if you've had the vaccine, you probably also had COVID. And so you're getting this double whammy. And so I keep seeing people with that. And there are definitely some things to do. So I'm going to start a group for people having symptoms from COVID or from the vaccines. And so hopefully that will help bring a little functional medicine that people can afford in an upcoming year. I think that those are the plans. I'd like to continue the detox that I've been running, because it is a mind, body, spirit detox. So I think it goes along well with everything else that we're doing. It teaches you how to eat, how to detox your mind, how to detox your thoughts, how to detox the people around you and your situation. So I've been missing doing that the last few years. And so I'm going to bring that back as well. I think that's all that I've planned for now.